And kids nowadays are 100% sure and certain about what they want in their life. In the very early stage, they would start saying, oh, I don't want to do this or I don't want to do that. And you don't have to be able to do everything. You have to have done all work at certain level. I will give you a little bit of my background, and that will probably give you a bit of an idea on how I went on to become a dentist. Okay, so in India, when I was after doing the year 12, we have an entrance exam, and I did the entrance exam, and then as it happened to be that you get all India rankings, there are hundreds of thousands of candidates would do the exam, and then out of that there is a handful of students who are selected for that position. And then based on that, then you go and apply for the colleges, and then you apply for the field that you are after, a medical or a dental field. That's what you will get in the health sector. And then you choose the college and then you go for it because you want to become a doctor, right? And to be perfectly honest with you, in the first year of my dental school, I did not know very much about what I was getting into, what I was going to do. Now, some kids these days, I must say, I'm talking about things 22, not 22. I got into dental school 26 years ago. So I'm talking about things probably absolutely previous generation. And kids nowadays are 100% sure and certain about what they want in their life. That is fantastic. If you know exactly what you want to do, go for it. Don't take any shortcuts. Go for your life. Like as I always say, over prepare, commit to yourself and get it. But if you are in any sort of dilemma, I can definitely help you with that. If you have any sort of dilemma, or if you are unsure about it and you are just unable to make a decision, all I would actually say is that the best way of knowing what works the best for you is by putting everything to practice. Rather than you sitting there pondering about it and trying to just mentally think of what would be the best option, if you put that into practice, and how do you do that really, is that if you get into general dentistry, do the full range of treatment as what you can do as a general dentist. And then once you have done all the different fields, and then you pick on it and you determine, okay, this is something that some people, you will know, believe me, you will know if you like your red wines or the white wines, if you are a surgical person or if you are a cosmetic person. Right? If you are a cosmetic person, if you like the whites of the teeth, go for it. Explore your options. Then you can go and get into, all sorts of prosthodontics, restorative side of things. You can do endodontics. You can do root canal treatments and things like that. But if you get that kick, if you feel that you are made for the blood and gore, go for the implant surgeries, go for the gum lifts, go and become a periodontist, a maxillofacial surgeon. It's very difficult. Look, each and every modality is an absolute, I have to be honest with you, I'm not a specialist. I'm a general dentist with special interests. So I cannot give you a complete answer to that. And I don't think I have that sort of a knowledge base where I can tell you that this specialty is better than the other. But I can definitely help you make the decision, because even as a general dentist, I have gotten to a point where I actually only do things that I like. And I have only gotten to know that by doing everything in my early days of practice. In the first 15 years of my dental practice, I did everything, starting from a regular checkup and clean to a simple occlusal filling, to crowns, veneers, doing, CEREC crowns, which is a single visit crown, do radiographs, impressions. I love doing dental impressions. I love doing dental. I see a lot of practitioners these days, they are like, oh, in the very early stage, they would start saying, oh, I don't want to do this or I don't want to do that. And I'm like, hold on a second. You have to. You have to do the most basic stuff. You have to explore all the options for you to be able to nitpicking later on and saying, okay, I don't want to do this, because believe it or not, they are all interlinked. Even when I am not doing root canal treatments anymore, or I'm not doing, composite work, if I have never done that, then I am limited to what I can offer to the patient. Because one thing that you have to always do, be a general dentist, be a specialist, you have to holistically remember. And honestly, you will ask me till the last day of my practicing as a dentist, I will always say this: you have to be holistically plan the case. And you can never plan something holistically unless you know and you are fully aware of all sorts of treatment modalities. You provide that treatment or not, that's a totally different thing. There are a whole heap of specialists, some fantastic people who can do work, absolutely fantastic. There are some general dentists who provide great treatment to the patients. You don't have to be able to do everything, but you have to have done all work at certain level, explored all the options, and then made a decision on it that this is what gets me going. This is what makes me wake up in the morning and turn up to work. This is what makes me feel excited about being in a dental practice. And once you have done that, decide on your specialty, go for it. And who knows, maybe after a few years, you will say, look, you know what? I love doing dentistry, but dentistry has actually opened me completely to a different thing, which is human relation, talking to people, getting to know people. And you will develop a totally different aspect from it. But you have to do everything to a certain basic level before making that call. That's what I would say.
Please get on your knees. Came from the jungle, up in the trees. I got a few tricks up in the sleeve. One wrong move, I'ma let out the